Welcome back. Today we are giving you part 2 of GLP-1s through a functional medicine lens. That's with Dr. Elroy Vojdani. We started off part 2 by asking him about microdosing. So we will get into that and continue on with some natural GLP-1 alternatives and much more. So please take a listen and enjoy.
I'll answer your question, Emily. We never answered the microdosing question.
Oh, okay. Well, yeah, we're good about skipping around. So, yeah. How about we go back to the microdosing question first?
Okay. So if we're not taking the traditional pharmaceutical dosing of semaglutide or tirzepatide and saying like maybe those aren't great long-term or longer-term health applications of these things, then taking smaller than the traditional amounts would be what we call microdosing. And that's becoming very common. That would be done through compounding pharmacies, sometimes through people who are selling peptides directly to people on social and on the internet, which is, again, a completely unregulated space. And you have no idea what's really in those vials. So
be wary. Yeah.
Be very wary. I would say you're much better off doing this through a physician that you trust and can vet this stuff for you and kind of make sure that you're doing it in the right way. But yeah, I think a lot of people are having a lot of success with something like a tiny amount of tirzepatide. People are like shutting off that like snack signal that happens to them all day or whatever. And it ends up just being like the little thing that they needed to make forward progress, and why the microdosing is so popular these days. It does seem like a really valuable tool.
So you make a lot of very compelling cases here. We've heard cancer, we've heard dementia, all of these things. What about women who take GLP-1s who don't really need it?
Well, I think that's probably some human nature that's kind of sneaking into behavior these days. Again, the principle, the foundations of health are eating clean, cleaning up your environment, sleeping, taking care of yourself. Those things pay massive dividends over the course of someone's life. But they require a lot of work, as the three of us know. You basically just have to say, this is how I'm living my life. This is what I'm going to do. I'm going to put the time and effort into doing this. And sometimes that's daunting for a lot of people, right? And injecting yourself with something once a week and getting the kind of like physical manifestation that you're looking for is an easier pathway, I think. But it's not going to have those same long-term dividends that are going to be paid out. You're, I think, literally doing that for the physical without the health part of it. And ideally, you're doing it for both. I don't think there's anything wrong with a human being saying, I want to improve my physical state, but you want to also improve your health at the same time. That's, where the idea of improving your physical state even came from, because it's a healthy thing to do.
Exactly.
Right. So I think that's the problem.
Did we get your answer on berberine?
So the natural GLP-1 alternatives are becoming a very long list, actually. It turns out that there are several things that will increase the amount of GLP-1 that you naturally produce. Remember, it's an internal messaging protein, so you can make it. Berberine's definitely the most popular of them. It does kind of act as what they call a natural GLP-1. It's much more weak than an actual injectable GLP-1, but it's very healthy in a multitude of ways. Berberine decreases blood sugar spikes. It's kind of cleansing to the microbiome, especially with fungus, which we're finding as being a big part of kind of today's microbiome landscape. It has direct anti-inflammatory benefits. So berberine's one of those things where you get like so many potential benefits out of it. I think it oftentimes becomes like a no-brainer to add instead of doing something like a GLP-1. There's a species of probiotics called Akkermansia that you'll see marketed out there by several companies these days that has some data that says that it increases GLP-1 activity. I'd say we find clinically the berberine to be more effective than the Akkermansia, but the Akkermansia can certainly help as well. There's a whole slew of fiber products that are coming to the market these days that have data actually showing that they'll increase GLP-1 activity because it's very gut microbiome modulated. And so I think those are also great because fiber fuels your microbiome in a positive way. You get the GLP-1 activity out of it. And that's, again, good for you in many ways versus like the counter of an injectable GLP-1 kind of on its own, not necessarily being healthy.
I'm going to ask you a controversial question, and maybe you don't want to answer this, but I'm just throwing it out there. Do you think that the COVID shot or COVID itself has any relation to any of the GLP-1 issues that we're seeing?
Well, okay, so I like answering this question, and I think I'm somewhat uniquely positioned to answer a question
Because of
like
your
this
research.
because, I also do research in addition to being in the clinical space, and a lot of our research in 2020, 2021, 2022 was entirely directed on the impact of COVID and potentially vaccines on the immune system. Let's say that specifically is what my research has been in. And then I've got the collective experience of these patients here in the last 5 years, and we see a lot of long COVID patients in the clinic as well too. I don't think this is a controversial take at all. COVID vaccines and COVID have done something to the immune system, for sure. Weakening them temporarily, modifying them to be in a pro-inflammatory state, changing the microbiome composition. There's data out there for all of those things, and I would say that's not controversial at all from a scientific perspective. Now, again, I started off by telling you guys that the space that scientific medical literature is going to is what we call immunometabolism, again, which is the interplay of metabolism with the immune system. And the paradigm there is what happens on the metabolic state influences the immune state. What happens in the immune state happens in the metabolic state. So if you get something like COVID vaccines, and they're modifying the immune state, I think it's very logical to assume that they're modulating the metabolic state and making that dysfunctional as well at the same time. I would say there's a large group of people who would find themselves more tired, having a harder time losing weight, maybe a little bit more brain fog in recovering from COVID and or vaccines. And the things that they used to do to help them lose weight weren't working anymore. And that's a logical decision to go into something like a GLP-1 to potentially help with that. I'll tell you, one of the more fascinating clinical experiences has been that sometimes in our very, very difficult long COVID patients, even if the person doesn't have any kind of overt signs of metabolic dysfunction, in other words, they look healthy body habitus and body fat, and they, before long COVID, were exercising regularly, if we give them microdoses of GLP-1s, it can dramatically help them recover from the long COVID state.
Wow, this is like really compelling. Okay, now we're even going deeper here. We got to get into, because our whole audience loved you on menopause and perimenopause. So we got to talk about the intersection between GLP-1s and menopause and perimenopause, because there's a lot out there.
Okay.
Researching for this podcast, there's like 75 podcasts on this topic alone. So you give us your take.
Yeah, again, I don't think controversial at all at this point. It's pretty clear that when you improve the metabolic state, the hormonal state for particularly perimenopausal females will improve. The ovaries are very glucose window sensitive. In other words, they have this like little sweet spot that they like to function in. And if you go below or you go above, they tend not to produce as much estrogen as they would otherwise. And that can amplify a perimenopause experience, right? So you go on a GLP-1, the metabolic window kind of comes back into what it's supposed to be, and the ovaries all of a sudden produce more estrogen than they were before, and perimenopause symptoms no more. And that's pretty straightforward, and we see that clinically all the time. Again, I don't think that's a replacement for doing all the things you're supposed to in perimenopause, which is eating clean, taking hormonal supportive supplements, exercising. HRT is definitely, I think, rightfully so, becoming more of a regular part of the conversation as well too. But again, is it a tool that helps? Yes, that's what your question was. It does help. Interestingly, also, if you kind of come back to other issues that happen on the hormonal side prior to perimenopause, which we'll say endometriosis will be absolutely number one on that list, and the epidemic of endometriosis right now in the population is absolutely exploding. Endometriosis is a immunometabolic condition. In other words, it's driven by improper metabolism at the cell level and chronic inflammation driving those issues. So GLP-1s are almost becoming like the standard of care now for endometriosis. And then the second one, same thing, PCOS, chronic inflammatory immunometabolic condition. GLP-1s are, I think, arguably the standard of care now for PCOS.
So are people
Yeah.
having to stay on this forever?
I don't advocate for that. They're a tool. You kind of think about, again, I know this is a complicated word, immunometabolism. It's a stuck position, right? Like you're metabolically stuck, you're inflammatory stuck. And while you're in that stuck space, it's very difficult to make progress. So if the GLP-1 gets you out of a stuck space and you can start making progress, then you keep making progress. So I like limiting the use to unstucking you.
But do you see people making progress and without it and keeping going without it?
For sure. Yes. Again, it's all hard work on our end as clinicians and hard work on your end as patients, but you've got to change your life, right?
So going back to PCOS and endometriosis, are those patients then having an easier time getting pregnant without fertility?
It depends a lot on, again, how much of the other stuff they're doing. I think, again, a GLP-1 will probably make their fertility chances better. But if you pair that with gut cleansing, anti-inflammatory eating, cleaning up your toxins, it's going to be exponentially better than just the GLP-1 by itself.
So we've heard about possible issues with oral hormone therapy absorption when taking GLP-1s. What are you seeing in real-world patients?
Let's kind of zoom out and see what the data says about oral versus topical placement of hormones as far as health benefits are concerned. I think the consensus is very, very clear right now that topicals are far superior to orals from a health benefit, which would be it doesn't have to go through any liver metabolism. When you use a topical, it goes straight into the blood, and therefore I think is more bioidentical if you want to think about it that way, right? We're trying to mimic essentially what the ovary would do in releasing estradiol, which is the dominant estrogen, into the blood. And if you take a pill and then it goes to the liver before it goes to the blood, it's not necessarily the same thing. Clearly, clinical benefit happens much better from a transdermal or topical version. Let's say a patch would be the type that has the most studies behind it. And the benefit is cardiovascular, so heart protection, brain protection, and bone protection. The data is quite overwhelming, I think, in the ApoE33 group. We talked about ApoE4 earlier. Interestingly enough, the ApoE33 group has very, very positive data for topical estrogen use. So I think you're starting to see more and more and more application of it in perimenopause, especially if it's early perimenopause. The ApoE4 group, which is the Alzheimer's risk, you would think would have like a clearer signal the other way, but it's not as clear as the ApoE3 group, and we don't necessarily understand why at this point.
Do women have to protect more on the bone density, muscle mass side while if they're in post menopause, whatever, while on these medications?
Well, I think the medications are kind of like potentially holding the bone status intact, when you start it going forward. That's a big reason to do it.
Well, you're talking HRTs. I mean, with the
GLP. Yes. Oh, you mean the GLP-1s?
Yeah.
Yeah. So if you hit that side too hard, taking too much in too short of a period of time, you're going to lose lots of vital tissue. That's muscle tissue, bone tissue, collagen, things that you don't want to be losing. And the way to counteract that is to make sure that you're not doing massive doses, you're exercising regularly, especially doing weight-bearing exercise while you're on a GLP-1. That doesn't have to mean using dumbbells. It could be Pilates, it could be yoga. It's just making sure that you're engaging your muscles. And then, eating a healthy amount. You can't take a GLP-1 and then have half a muffin for breakfast and half a muffin for lunch and be like, great, I had 600 calories and I'm good to go.
Right.
You need to make sure you're eating a decent amount of protein, veggies for the antioxidants, all the normal things kind of go into the conversation. Even if you don't feel like eating as much as you did before, it still has to be healthy.
Is there a link between GLP-1 use and like hot flashes or mood changes or sleep quality in perimenopause and menopause? We don't know yet.
You mean on the benefit side?
Mm-hmm.
Yeah, I would say in the clinical application of it, there does seem to be pretty clear benefits to people. I don't think there's data on that yet. And again, it's because in perimenopause, you're kind of like struggling to maintain the amount of estrogen that the tissue needs to see. Let's say you get a 20% boost. That's enough for the receptors to kind of breathe and kind of say, yeah, I'm fine here. It won't last forever, right? It might give you another year or two. But it does give you a year or two, which is a huge benefit.
Wait, so then why wouldn't women take these anyways to like delay perimenopause?
In a completely metabolically healthy person,
Mm-hmm.
the GLP-1s are not going to be beneficial, right? This is for somebody who has some type of immunometabolic dysfunction. So you've been living clean, you're eating clean, you're exercising regularly, your lab tests look sparkling. A GLP-1, I think, is only going to potentially hurt you. I don't think it's going to help
Sure.
you.
So what is the downside? Like, yeah, what does hurt you mean? What does that mean?
I think it's all about tissue loss from a bigger picture perspective. There are the side effects to consider, which even tirzepatide, doesn't make you feel fantastic, even at microdoses, right? A lot of them also tend to stress the nervous system out a little bit, and that's probably because of the fat loss. The body doesn't love being in like fat loss state all the time. We're meant to kind of be flipping between the two sides. It can make insomnia a little bit worse because of that for some people.
Wow.
And again, yeah, you're going to lose tissue. You're going to lose fat. You're going to lose collagen. You're going to lose muscle, and hopefully not too much muscle. But you're still going to lose
That's
some.
why you can kind of tell, and like their arms, like you can tell, like it looks like they're like 80, for lack of a better way of saying it.
Yeah, yes, and we have to kind of talk about like what are normal aging mechanisms in the body, and will a GLP-1 actually potentially accelerate that? That's an important convo. Healthy aging is switching back and forth between build and repair, or build and cleanse. Like you build, you cleanse, you build, you cleanse. That's the healthiest way to age. When you're on a GLP-1, you're kind of stuck in the cleanse phase. You're like pulling tissue out, breaking it down, but you're never able to actually fully build because you're holding that side back. So part of what Ozempic face is the rapid loss of tissue and collagen in the body and muscle, but it's also like you're hitting the cleanse and remove side a little bit too hard, especially at the full therapeutic doses.
So also in terms of concerns and downsides, how concerned should people be about gallbladder issues, pancreatitis, gut motility problems, etc.?
The gut motility problems, I think, are real. There's a relatively small subset of people who are like hypersensitive to this.
What is gut motility? I feel like.
Yeah, so the compounds, one of the way they work is they slow down your stomach. So like you eat, and the normal response from the stomach is to take that food, start digesting it, and then push it through to the rest of the intestinal tract. And if you're on a GLP-1, it'll just kind of sit in your stomach for long periods of time. It could be upwards of 24 hours for some people.
Wow. It was typical.
30 to 60 minutes would be typical. And then on a GLP-1, like it could be up to 24 hours. And then you're also like not pooping for 3 days sometimes too.
Oh, all right. I definitely can't take GLP-1.
Yeah. So again, I think that's on like bigger doses than people need to be on, which unfortunately human beings like that kind of stuff. They're like, give me the max. But it still happens even at the smaller doses. Not for most people, their body gets acclimated to that part of it, and it kind of goes back to like a new normal that's not anywhere near as bad as the first couple of injections. But some of it will still be there. And then the gallbladder and pancreatic stuff is also real for sure. I always say if you've had a gallbladder issue before, like you have gallstones or you get gallbladder attacks, the GLP-1s are not for you, because they are going to get your gallbladder to get stuck in the full space also. And then the pancreatic issues seem to be also less rare than they were originally reported in the initial data.
What about the oral GLPs that are coming out?
Really interesting. So the hardest part with peptides in general is that they're not they're not something that can handle the environment of the stomach intact because they're very fragile, which is why we inject them. So they go directly into the bloodstream. If they touch the stomach acid, they fall apart. They're not going to have any efficacy. So what the pharmaceutical companies have done is they've kind of created these delivery techniques where you can get them through the stomach without falling apart, and then they enter the bloodstream in some proportion intact. So it's basically the same as doing an injectable. You just have to take them daily, and they have very similar effects, and they're going to be a lot more popular than the injectables for understandable reasons going forward, I think.
You have to inject yourself every day with these things?
No, they're weekly injections.
One more question. What happens when someone stops taking them?
It's like the biggest question that people ask when you start a GLP-1 is what's going to happen when I stop the GLP-1? And again, for somebody who just takes it without doing all the other things in their life, they are very likely going to gain the overwhelming majority of weight back. And most of it's not going to be muscle. Most of it will be just predominantly fat loss or fat gains. You actually like shift your body dynamic in a negative way in that situation. Our experience when we're using them in people who are kind of doing the normal healthy stuff is you might gain 3 to 5 pounds back max, let's say over the course of several months, but then it just becomes sustainable, permanent weight loss for them afterwards because we do it lower and slower, and we, kind of make sure that all the other things are in place there for them to maintain their benefit.
Because you're working on the whole body picture and everything that goes into it.
Exactly. We're making sure that we used it as a unstuck tool, and then making sure the rest of the body has everything that it needs to keep going forward after you've kind of made that initial push.
Well, you know that everybody hearing this is going to want to call you.
I appreciate it. So I am actually actively taking patients. I don't know for how long, but maybe for the next few months, I will be taking patients for 2026. So you can call the clinic. I think the easiest way to find our information is on our website, which is regeneramedical.com. I have licenses in California, Arizona, Utah, Texas, and Florida. So if you're in one of those states, I can directly help you. Otherwise, I can't. Sorry. I can't have a license in every single state. It's too much. I'm getting a lot of requests from, honestly, other physicians in this space who have been groundbreaking physicians who are just kind of telling me, you need to put this information out there for people as well too. So I decided to start a Substack as well. And
I love Substack.
So look out for, I'd say subscribe to the Substack. A lot of it is going to be free. It's called The Inflamed Generation. And it's basically going to be all about everything that we talked about in this podcast with you guys. So the general information, highlights on things like GLP-1s, NAD, questions that I get in the clinic all the time. And I think I'll also put specific case examples up there of things that come into the clinic, what we do, what the outcome was. Really doing it more as a way to just kind of spread the information because there's not a lot of great medical information out there in the social sphere.
Well, we will link the Substack here for all of you who want to subscribe because I feel like that's going to be amazing information.
Yes, it definitely.
I love the name of it too.
I know, great name.
Johnny, will you come back again, please, for more topics because we have so.
You guys know I'll do your podcast anytime you want to. I enjoy it.
Don't careful what you say because
there's not a lot of great sources of real health information. There are people who parrot stuff and they've never seen a patient in their entire life and act like they're the
guru,
the messiah of the topic. And I would rather people have real information that comes straight from the clinic. So I'm happy to hop on here whenever you guys want.
Thank you.
Thank you.
This podcast does not constitute medical advice or recommendation. Please consult your doctor.